see it if they have it. But that's one thing that you're always checking for, and that's why on the upright you include the diaphragm, because free air, because air rises, would come up underneath the diaphragm and give you a little crescent shape of air that you would see. The other thing you're checking for with the upright is if they have any air fluid levels inside the bowel, which could indicate that they have an obstruction or something. So that's kind of what you're looking for. And because we're looking for air to rise, whether inside or outside the bowel, then the patient needs to be erect for a few minutes before that. So in either walking them from the ER or riding them in a wheelchair, as long as they haven't been laying flat, then just sitting upright is enough upright to get that air to come up. So my suggestion is always to do the upright first. Even if, because if they come down riding on a stretcher, then probably you're not going to stand up anyway. Probably. So to do the upright first, and even having them stand there long enough for you to have everything set up and centered will probably give you that few minutes that you would need anyway. And then you do them flat on the table afterwards, and then you can leave them laying on the table, which would be, in theory, more comfortable than any other position while you check your images. So we're going to start with that. We will not shield, because in the abdomen you can't. I know somebody in the last lab said that they, at Marshall though, are shielding male patients. They have a small shield that can be placed outside, but male gonads are outside of the abdomen, so you can do that. You just have to be sure not to get all of the symphysis, because you have to be able to see the top of the symphysis to be sure that you've got everything. The upright must have diaphragm. The flat must have symphysis. If you're not very tall, you may be able to get both. And so we'll show on Miss Hutz generally, I center a little bit above the crest, and I'll show you that to make sure I have the diaphragm. But if you can center at the crest and feel good about diaphragm and getting symphysis, do that. If you're concerned you think it might be close, then center just a little bit higher to make sure you have diaphragm. Critical to check for pregnancy. I remember working and bringing a patient over from the ER one time, and I said, "Is there any chance you could be pregnant?" And she said, "Well, I've been to the fertility clinic 3 times this week, but I don't think so." You've been to the fertility clinic 3 times this week. I think we should check that, because when a female has abdominal pain, it could be an ectopic pregnancy. So you want to be, it's always important to ask that question, but critically when you do an abdomen, because you don't want to be shooting the abdomen when they're pregnant. And she ended up being pregnant. As a matter of fact, I took her back to the ER to have the abdomen checked, and then we never heard back from them. And we said, "Hey, what's the deal?" And he said, "Oh, she's pregnant. We're not sending her. We're going to send her to ultrasound." Okay, so be sure you do that. I'm going to go ahead and set up the room. Because we're at abdomen now, I'm going to be at 40 inches and perpendicular, so I'm going to get mine. And I do suggest bringing it, even though you're going to have to change the height, bring it up to your height so you can see well. Make sure that this is flat. Okay, even if it looks like it says 90, make sure this is flat. And it's hard to tell that if it's way above or below you, but especially if it's below you, to tell if there's any angle on it or not. So be sure that's perpendicular. Be sure you're locked in transversely. Okay, and then I can just come back and center this up so I can check my collimation. And it's okay just to come and collimate into the black lines, okay? It'll show on here a little bit larger, but that's okay. Fill into the black lines up. That's really going to be okay. I'm going to use my cassette lengthwise, black side out. I'm going to put the blocker at the bottom. I know none of you use film, but I'm going to place the blocker at the bottom so it will be in the pelvis and not up where any free air would be, which would be a bad thing. You can mark the right or the left side here. I'm going to mark the left because it's closer to me. And I can mark the left here, and then when they lay on the table, the right side's closer, and I'm going to use the right one there. That's also a way, if you don't, now, I have y'all's markers, by the way, to give them to you today. Your markers have the little bead, so the bead will go to the bottom for your upright, and it'll be in the center for your flat, so that'll always tell the position if you use the same marker. If you ever work somewhere and you don't have those kind of markers, if you use the left on the upright and the right on the flat, you'll always know which one's which. That's the other way you can do that. So it's just another thing you can do. All right, I think I'm ready to get my patient. Miss Utz. Yeah. My name's Gina. I'm going to take you in for your x-ray. I'll be taking your x-rays today. Okay. All right, you'll just follow me. Okay, can you repeat your, check your RBA, your full name for me? And your date of birth?
September 1st, 1935.
Okay, very good. I see here that you're here to have some abdomen films taken.
Mm-hmm.
You've been, what kind of problems have you been having?
A lot of abdominal pain. pain right about there.
There on your right lower side.
Yeah.
Okay. All right, well, we're going to take a couple of different images here, one with you standing up and one with you laying down. Okay. Any chance you could be pregnant? Okay. Need you to change into the gown for me. Need you to take everything off. You can leave your panties on as long as there's not any metal.
Okay.
But the bra needs to come off, and if you have any piercings in the abdominal area, like a belly button ring or anything like that, it would need to be removed.
Okay.
Okay, and the gown just opens up to the back.
Okay.
All right. Okay, you'll just step up here for me. We're going to get the first one with you standing up. Need you just to put your back up against this board for me. That's good. So I'm going to find her crest, and I'm going to center 2 to 3 finger widths above the crest is usually a pretty good place to be. Now, when you're at clinic, like I said, she's a little bit taller. That's why I'm going to center a little above the crest. You will see people just say, put the top of the cassette in their armpit. That's what, I mean, that's almost all my chest. I think that's overkill because you still want to get as much of the abdomen as possible. So I think that's a little excessive. Even with me going 2 to 3 finger widths above her crest, I'm still going to be up into her chest fairly well, and I'll show y'all that. So there. Bring this up. Just lean forward a little bit for me. Bring this up. Okay, now here's the bottom, so you can tell I'm almost to symphysis, just in a guesstimate here. And here's the top, which is up into her arm. You can tell I'm going to have plenty of chest. I'm going to have diaphragm, but I'm not all the way up into her armpit. So I'm still going to get the majority of her abdomen. Then I want to be sure she's centered to the mid-sagittal plane. Step you over just a little bit. Okay. And ask you just to keep her arms out away from the body. You don't have to do a big arm movement. If they're standing there with their arms straight against their body, then they should come out just a little bit so you don't get arm shadow based upon their size and stuff. But normally it doesn't have to be a big movement or anything like that. We always want to shoot abdomens on expiration because that makes the diaphragm go what direction? Up. Up. And that way I get more uniform density all through my abdomen. Everything's more uniform. So, I just need you to take in a deep breath and blow it all the way out and hold it out. Don't breathe, don't move. That's it. That don't look too bad, does it? Yay. Okay, doing all right? I could just come over here. I'm going to let you have a seat on the table for me. Okay, let you lay back. I'm going to just give her a little neck support. Okay. Put a sheet over. Do want you to use the sheet. That'll be evaluated in the patient comfort aspect of the evaluation. Okay, I'm going to come back perpendicular now to the table. And I want to be 40 inches to the bucky. I'm still locked in transverse, so I'm good. Still going to go lengthwise with it. I have a right marker conveniently located in my bucky. So I can slide this in, and I'm just going to put that right marker above this little blocker here. If you were really using film, that's a lead blocker. The marker won't show up if you put it in on top of it. Okay. Notice I'm bending over. If you're bending over a lot, your table's not the right height. And remember, those distances only work at the working height. So I'm going to bring this up. And now I'm going to come back. I'm going to center at her crest, but I have to be sure. Set. Yeah, try not to just get my butt in the hole.
I was trying not to.
I appreciate that. So I'm going to center at the crest. I have to be sure on this one that I've gotten the symphysis on here. Okay. And so what I can do is I can find her greater trochanter. We're never going to palpate symphysis. That'll put you in a lot of trouble if you palpate symphysis. So we don't want to do that. I'm going to find her greater trochanter. And what I can do is look where the bottom of my cassette is, and I can see the bottom of my cassette is lower than that point. I'm going to have symphysis. Okay. So I'm centered at the crest and to the mid-sagittal plane. Then I need to look and see, and you can go from the foot or the head, it doesn't make any difference. But you want to make sure that hips and shoulders are in alignment, that your patient's not all cattywampus on the table. Okay? Straight there. Okay? So that would be good, and then I would give the same breathing instructions, taking a breath, blow it out, hold it out, don't breathe, don't move. Now, any of you at a place that doesn't use cassettes?
Well, they don't really use them very much. They have
Where are you at?
RMC.
Oh yeah, they're not using cassettes. Okay, if you're at a place that doesn't use cassettes, let me show you this, because you won't have the bottom of the cassette to look at to be sure that you've included that. But all you have to do is center how you think you want to center. Then move the table over, bring your light field onto the tabletop. Now you can evaluate where the light field is, okay? Because it'll look higher up on the patient because the light field will always look smaller. I'll show you that in a second. And so you can do that. Marker placement, you'll see people putting their markers on the patient. Not a fan of it, but be sure you're cleaning your markers regularly. For several reasons, because you're keeping them in your pocket or on you most of the time, and from patient to patient, you don't want to be passing anything around from patient to patient. If you were doing an abdomen and you're not really collimating, so we have large collimation here, you know, I could ask her to roll up a little bit, and I could place my marker right here underneath her and have her roll back. When we get into doing spines, it's way in under the patient. I'm not sure it would be worth it because it'd be a lot of movement for the patient, and it would be better, I hate to say it, to put it on the patient, but you're kind of limited options at that point. But here you could do that, but most of the time if you just, you know, slide over, you can look and see and trust your centering that you know. Don't be misled by the size of the light field, because the larger your patient is, the smaller the light field is going to look. Well, this is pretty thick. There's 2 pillows in there, so I'm just going to lay the whole thing on you. So if I lay this here, look how small that light field looks.
It's because you're getting closer to it.
Yes. Yeah, it's a whole physics thing and everything. But don't be saying, oh, I got to have light field to here. You'll have half the leg on there. I mean, you'll be halfway to the knee if you center from that. So you've got to trust what you feel as where your centering point should be. And keep that in mind, and check your cassette if you have the cassette available to do that. Don't be misled by the light field, because that can throw you. Don't allow it to throw you off. The body is the body. Everything, you know, goes with the person's body habitus, and it'll follow along. Okay. Funky monkey. Okay, and then when you're done, you're getting your patient up, I will move this down and out of the way. Always, if you have a patient laying on the table when you're finished, always move the tube from over your patient. Like if you're going to check your images, don't leave it over the patient for a couple of reasons. One, if the power goes off, the tubes fall sometimes. Now they don't go crashing down or anything, but they do ease down a little bit. So you don't want that to happen. More likely what would occur is your patient might get tired of laying there and either sit up and hit their head on it, which would be a bad thing, or try to get up and need some help and pull the cords to do that. And then that's a problem. So always move it down, you know, out of the way of the patient in case they decide they want to get up. At least they're not going to, well, yeah, they could hurt themselves, but at least they're not going to do it with the tube. So, sure do that. Okay. I hear y'all decided who's going when and all that kind of thing. So that's great. So those of you who are going to check off in here first can stay